So, Unit 1, Principles of Anatomy and Physiology in Sports, Topic 5, Energy Systems. So I'm going to be analysing the different energy systems and explain their use in a number of different sports. So first off, we're going to talk about the energy continuum. Starts off at the ATP PCR system, 0 to 15 seconds maximal. Next up is the glycolysis system. It can last to between 15 and 50 seconds. The oxidative system, it can last from 50 seconds to 2 hours plus. So, as I've said, the energy systems. The ATP PCR system is used in sports like the 100-meter sprint. Glycolysis is usually used in games such as rugby and football. And the oxidative system is usually used in long duration sports such as the marathon. The lactic acid system is usually used in the 400-meter race. So the ATP PCR system, it works without oxygen and can sustain all-out exercise for 3 to 15 seconds. It produces energy at 36 calories per minute, and its strength is that it's high intensity and a short burst, but its weakness is that it doesn't last very long. Next up is the glycolysis system. The end product can either be pyruvic acid, which is otherwise known as aerobic glycolysis, or lactic acid, which is otherwise known as anaerobic glycolysis. It's moderate power over a moderate duration and can produce energy at 16 calories per minute. The strength is that it lasts for 50 seconds, but the weakness is that when the lactic acid forms up, the power output decreases and causes muscle fatigue. Next up is the oxidative system. It requires oxygen and results in 34 ATPs being formed. It's usually used during rest or low intensity sports and can produce energy at 10 calories per minute. The strength is that it's long duration, but the weakness is that it's got low power. The lactic acid system, it's a short-term energy system for high-intensity sports over a longer period, such as the 400 meters. It's anaerobic, which means it doesn't require oxygen. It can last for 60 to 90 seconds. And the lactic acid is the limiting factor of the anaerobic system. It accumulates in the system and diffuses into the muscles and blood. And if it's not removed by the cardiovascular system, then it causes fatigue and an uncomfortable burning sensation in the muscles.